Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we will discuss about write-off amount in medical billing, also known as a adjustment amount, and sometimes it will be called as a provider's discount amount in a medical billing. So generally what happen whenever the claims are submitted to insurance company will deny the claim or otherwise will give the payment to the doctors. So at the time we will see the discount amount on a medical claim, and sometimes they are not give any payments to the doctor, and they will give the reason why they are not giving payments to the doctor. At the time also we can go for adjustment, and that will be also known as a write-off exactly. So in this video I will explain what is mean by write-off and adjustments exactly, and what are the example for the write-off and also adjustments. Guys, if you are watching our video first time, if you not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth and hit the bell icon so that you will get every our video as a notifications to your mobile or desktop. Okay guys, now we are discussing about write-off amount in medical billing. See, write-off is an amount which is not collectible from the insurance company as well as a from the patient. So here doctor is not getting any benefit from the insurance as well as a patient in terms of dollars. So here what I'm telling is, if you are submitting a medical claim to insurance, insurance will receive your claim, and insurance will process your claim, but they will not allow your claim. Whatever you build a charge amount to insurance, insurance will not allowed any amount from their side to the doctor. So if there is no allowed amount means there is a no provider paid to amount is $0 even, and also there is a no patient responsibility is also available for that particular claim. Nothing but your doctor is not getting allowed amount from the insurance company. Nothing but doctor is not getting any payment from the insurance company, as well as there is a no rights to get the uh, amounts from the patient also, because that claim is not allowed by the insurance. So here doctor what should have to do, doctor should have to adjust that balance as a write off amount. That is what write off. So simply we have to understand that doctor will not get any benefits from the patient as well as a insurance. So here that amount is known as a write off amount. So what happen if the, for example, insurance is not allowed? Nothing but there is a no payment to the doctor, nothing but there is a $0 payments to the doctor. So that is known as a denial in our medical terminology. That claim is known as a denial. So we will discuss in next slide what are the examples for the write-off. And also I given one more point guys. Here the write-off adjustment enables you to adjust account balances that you do not think will be paid, means it will be not allowed by the insurance. Okay guys, we will discuss with one practical example. For example, a claim with bill amount $500 even, it is billed to insurance company, and here insurance allowed amount is zero. Nothing but insurance is does not allowed any amount to the that particular claim whatever you bill to insurance. And here the patient responsibility is obviously zero because there is no allowed amount at that particular claim. It's a $0. So here I mentioned like PR1, it's nothing but it is a deductible amount. Here PR2 is nothing but patient responsibility. That PR2 code is known for a, it is a co-insurance. And the PR3 is known as a patient responsibility 3 code is for copay. So these all are the zeros. For example, if there is no allowed amount on a claim, and here paid to provider amount is also $0 even because allowed amount is a zero on that particular claim. And here why it is not allowed, they will give the denied reason and particular denied EOBs, whatever the document which is received from the insurance to the doctor, that EOB or that document and that PDF file having the reason why they are not giving the payments to the doctor. So that is known as a denied EOB. Generally, we will see all this kind of informations on a PDF. So this is known as a explanation of benefits that will be having the denied code why insurance is not giving the payment to the doctor. So example I given denial code as a CO18 is nothing but claim is billed more than once. So nothing but, for example, claim billed more than once at the time the insurance is telling that it is exactly duplicate. Nothing but it is already billed, we already processed, we already allowed, we already given payments to the doctor. This time we are not allowed any charges for your claim. Why? Because you billed more than once. Example one I given like a CO18 is a code for exactly duplicate. So in that way, insurance is not allowed this time. Why? Because we already given payment to the doctor on previous claim. Second scenario I given like a CO29 is a second example. It's a telling that timely filing has been expired. So there are a multiple insurance companies, and they, as per their guidelines, they have a timely filing limit to submit medical claims to the insurances. So for example, if you are taking any particular insurance, if they have a timely filing 90 days, so here the doctor or doctor's billing team should have to submit that claim within the 90 days, within the 90 days from the date of service to the insurance companies. So if you are filing the claims to the insurance companies after the 90 days, after the particular time frame, then insurance will deny like a we received the claim after the timely filing. Here the denial code from the insurance is CO29. They are telling that timely filing has been expired or exhausted for this claim. So at the time, the insurance will doesn't allow any amount on that particular claim whatever you build to the insurance after timely filing. So we have to understand that here our doctor will not get any payment because insurance is not allowed any amount. So the reason also they will provide why they are not allowed on that particular claim. So this is also one of the example for the write-off scenarios. So it doesn't mean that, so whatever build amount here $500 charge amount on that particular claim will be as a write-off amount. So here the provider what should have to do? It's a provider mistake. For example, provider is not submitted a claim within the time frame to the insurance. So whose mistake? It's a doctor's mistakes or doctor's billing office is mistake, because they are not submitted the claim within the time frame to the insurance. So as per insurance guidelines is they received the claim after the basic normal timely filing submission timely filing limit, so they will not allow the claim at the time. It's a doctor mistake, so that is what here the $500 amount will be known as a write-off amount. The provider will go for adjustment on that balance. So this kind of scenario is known as a write-off. Why we can call it as a write-off instead of adjustment means insurance does not allowed any amount on this particular scenario or this particular denials. So at the time we will known as a, this is known as a write-off scenario. So we have to understand this point. Okay guys, now we are discussing about adjustment. What is mean by adjustment in our medical billing? So I given here adjustments can ensure that the provider gets paid at least a certain percent of their fee. And also given one more point, adjustment can be discounted insurance rate from an insurance company. So generally, whenever you are submitting a medical claim to insurance company received the doctor's claim, and they processed the claim. After process the claim, they are telling that we are allowing this much of amount to the doctor, and the rest amount should be like a we are not, we are not allowed this amount. So they are telling that if, for example, you are submitting some amount to the insurance to the medical claim, at the time insurance will give only a fixed amount, we will cover this amount, the remaining amount we will not cover. So here the remaining amount whatever is not covered by the insurance will be go for adjustment. So in this scenario we have to understand that okay, insurance will give certain fixed and basic a percentage of amount to the doctor. So in this adjustment scenario the doctor will get some benefits from the insurance companies, but in write off the doctor will not get any benefits from the insurance companies and as well as from the patient. But here the doctor, in adjustment scenarios the doctor will get some benefits from the insurance companies. Okay guys, now we will discuss about one practical example to get clarification on a adjustment scenario. For example, we submitted claim to insurance with billed amount $500 even. Then insurance is allowed out of $100. So our doctor is billed $500 to the insurance company, but insurance is telling that okay, we received your $500, but we will allow only $100 to the doctor. So that out of $100, there is a $20 as a patient responsibility and $80 is the paid to provider amount. So here patient responsibility clearly they are telling that it is a co-insurance amount. So here co-insurance is nothing but PR2, it's nothing but co-insurance. And PR1 deductible is 0 on this claim, and PR3 copay is also 0. And paid to provider amount, I mean nothing but whatever insurance is paid to doctor is nothing but $80 even. So here insurance is allowed $100 even out of $500 even. So what about the remaining dollar? It's a $400 even. That $400 even will be go for adjustment amount. So now we can call it that rest amount as a adjustment amount. So that rest amount whenever claim is paid to doctor, then the rest amount on a paid EOB you will be see as a you can be see as a code CO45. They are telling that this is a contractual adjustment. There is a agreement between the doctor and insurance that whenever you are submitting certain kind of procedures to the insurance company will give only a fixed amount to the doctor, that will be known as a allowed amount. So more than that we will not provide irrespective. For example, there is a scenario, there is a one procedure code we used to get certain amount, but doctor billed a triple or double charges to the insurances, but insurance will give only that particular fixed amount to the doctor irrespective of billed amount. So that is known as a allowed amount to that particular procedures to that particular doctor. So in that way, irrespective, I mean the rest of the allowed amount on a billed claim is known as a contractual adjustments. So we have to understand that that amount will be go for adjustment. So here $500 is like a billed amount, allowed amount is $100, and the rest $400 is known as a adjustment amount on this scenario. For example, one more scenario also there. For example, $500 we bill to insurance. Insurance is allowed $100. That complete allowed amount will be go for patient responsibility. For example, we thought PR1 deductible is $100 even, and paid to provider is 0. Paid to provider is 0. At the time CO45 is also known as a $400 even. And we have to understand that why I can call it like $400 as a adjustment instead of write off in this scenario of a deductible means insurance is allowed $100 even. That is what I'm telling, that this is a adjustment scenario. So whenever the claim is processed towards a deductible and whenever the claim is paid to doctor, the remaining amount whatever the amount which is not allowed by the insurance, that amount will be known as a adjustment amount. We have to understand that point. Okay guys, we will discuss about some other adjustment scenarios while we are working on a claims. We will see that, for example, you are working on a secondary claim. So for example, the claim is billed to Medicare as a primary traditional Medicare, and Medicare paid, I mean, they are received the claim, and they process the claim, and they allowed some amount, and they gave the payment to some dollars to the doctor, and they also applied some patient responsibility on a claim that Medicare, traditional Medicare, cross over the claim to secondary insurance. For example, state Medicaid, respective state Medicaid. At the time, the state Medicaid program, they they also uh, allowed the claim, and also they are telling that we, the whatever the primary paid is already more than whatever secondary allowed amount. So the in that case, in that scenario, we will go for adjust the balance as a adjustment. So as a primary paid more than secondary adjustments, then we can call it like a pp max adjustments claims. So in that case, that is one of the scenario. I will provide the link of that scenario, pp max scenario, in this video. If you want to explore uh, more information, if you want to, I mean, if you want to gather more information, could you please explore that link, so that you will get clear idea what is the pp max scenario. So simply we have to understand that that balance will be go for adjustment. That is one kind of scenario. And some other scenario, small balance adjustment. For example, $1 or $2 are there. For example, we have to applied $1 to the co I mean co-insurance, for example. So are $3 to the co-insurance, $2 to the co-insurance. At the time, instead, at the time, if you are sending any statement to the patient, that will be charges to the doctor to the $3. So at the time, it is a better to adjust that small balance. So instead of sending any statements to the patient. So because patient statement charges are $3, but our uh, co-insurance is $2. So simply that kind of balance is known as a small balance. So that balance should be adjusted by the doctor to avoid more charges. So this kind of balance is also known as a adjustment required scenarios. Guys, if you felt content is useful, could you please like our video so that it will reach us many more needy people who are looking this kind of content. And again, thanks for watching. Have a good health. Bye for now.